Good morning, everyone. Welcome to our Tuesday morning seminar. It'll help if I could speak clearly this morning. I'm Rebecca Strauss, an employment lawyer here at Miller Johnson. Joining me is my partner, Sarah Willey. Good morning, Sarah.
Good morning.
Good morning. We're going to talk this morning, as most of you know, about the new CMS rule. This is part of our COVID-19 webinar series that's been going on now much longer than we ever thought would be necessary. But here we still are all together. So again, the topic is the CMS rule mandating COVID-19 vaccines for employees. Before we get into the meat of this morning's webinar, quick update on litigation. We got a question on this, and I'm so glad someone sent this question in ahead of time because I do think there is some confusion. So just so we're all on the same page, there is more than one rule from the federal government talking about COVID-19 vaccines, right? And most of you know that, right? There's more than one going on. Two rules were issued on the exact same day. This one, the CMS rule, and also the OSHA emergency temporary standard impacting all employees of 100 employees or more. I have a pet name for that one. I just call it the OSHA 100 plus rule because there's actually another OSHA rule too, right? That just impacts healthcare providers. And there's so many rules floating around. There's the rule for federal employees. There's the rule for federal contractors, right? It's none of this has been easy, and the vaccine rules are just following that same pattern. So, so last week on the exact same day, the OSHA 100 plus rule was published and the CMS rule was published. Some of you may have heard over the weekend that a federal court of appeals for the Fifth Circuit, which is not the circuit that covers Michigan, it's mostly down in Texas in that area. But anyway, they issued an order temporarily staying the OSHA 100 plus ETS, okay? And that stay is still in effect. The case is being briefed. It will soon be argued. We are hoping for some direction on that. Yesterday, our colleagues presented a webinar on that rule and talked about the litigation and what to do as a result of that stay, what employers should do. It's recorded if you missed it yesterday, and you are welcome to go back to our website and listen to that. The message we want to make sure you hear this morning is that litigation does not impact the CMS rule, okay?
Oh, so everyone has to stay on. Rebecca, is that what you're saying?
That's right. You are still on the hook. And if someone would like to hire us to challenge the CMS rule, let us know. But as far as we are aware, and that is just as of today, Tuesday morning at 8 o'clock, we are not aware of litigation challenging the CMS rule, and therefore we're not aware of a court issuing a stay for the CMS rule. So that stay is just the OSHA 100 plus. CMS folks, hang in there, stay with us. And if you're not sure if you're covered, that's the first topic we're going to get to. Okay, so that's that on the kind of the disclaimer on breaking news. So let's talk about the CMS rules highlights. This is, of course, just the highest level highlights. We're going to get into the weeds here. The rule highlights what you absolutely need to know if you don't already is that by December 6th, employees at covered facilities must receive their first or only, if it's a J&J, vaccine dose. Covered facilities must implement additional precautions for non-vaccinated employees. Covered facilities must implement all other requirements. I cannot read my slide because in the rule, besides the second dose, so all of the other requirements in the rule that we're going to talk about kick in by December 6th. And importantly, this is not a vaccine or test policy. Okay, that OSHA 100 plus rule we're referring to as a vaccine or test. This one is not. This one is different. So you do need to know if you're covered by this one or not. This is a vaccine policy, a mandatory vaccine policy, subject to exemption requests, which we are going to talk about in depth, but the actual policy must be a mandatory vaccine policy. Okay, so that's all by December 6th. And for those of you keeping track, that's not that far away, right? That's only about 4 weeks away. And in COVID time, that's nothing, right? 4 weeks is going to go lickety split. So glad you tuned in today. We're going to tell you all you need to do to be in compliance with the rule. And I'm sure you had nothing else to do the next 4 weeks, but you may want to reprioritize, right, to make sure you're on top of this one. By January 4th, that's kind of like the phase 2 of the rule. By January 4th, employees must receive their second vaccine dose if they're getting Pfizer or Moderna, right? That 2 vaccine series. Interestingly, that 14 days after the second dose period for the vaccine to be fully effective, that 14 days does not have to pass by January 4th, okay? So it's just the second dose, and then it would be another 14 days before the employee is fully vaccinated. Okay, with all of those highlights in mind, let's now really get into the weeds. Lots of questions that came in before the webinar about which facilities are covered. The general rule is that Medicare and Medicaid certified provider and supplier types, which we're just going to refer to as facilities, regulated under the Medicare health and safety standards, known as conditions of participation, conditions for coverage, or requirements for participation. Those are the facilities that are covered by the CMS rule. Note that this is not all healthcare organizations, right? This is a subset of healthcare providers. There are plenty of healthcare providers, and we're going to show you the slide on some that count, but there are plenty of healthcare providers that are not subject to conditions of participation, conditions for coverage, or requirements for participation to participate in Medicare. If some of you on the webinar do not know if your organization is subject to these conditions, I will bet a lot of money that someone in your organization knows. This is not the sort of thing that an organization kind of stumbles into, or with all due respect to Sarah and me, not the sort of thing that you're going to figure out for the first time on our webinar, right? This is kind of a major deal for your organization if you're subject to Medicare conditions of participation. You would have had to sign an agreement with the federal government. It would dictate lots of what your organization does day in, day out, completely aside from this new vaccine rule. The reason I think this is causing some confusion about who's covered and who's not is because of words that came out of President Biden's own mouth and his administration some time ago. When he was describing what this rule would look like, he and his administration said recipients of Medicare, right? Healthcare providers who participate in Medicare, receive Medicare, would be covered by this. The rule is actually narrower than that. So just because your organization receives Medicare reimbursements does not mean you are covered by this rule. Okay, we got lots of questions on that. It's only if you are subject to these conditions of participation, conditions of coverage, and requirements for participation. And again, someone in your organization knows the answer to that. It's probably your CEO, almost certainly does, COO, CFO, if you have compliance, right, managers, those quality managers, those types of folks. They would all be the people to ask if you don't know. But the rule and the FAQ that CMS issued does give us examples, right, of the types of organizations that are usually covered by these conditions of participation. So here is the list that CMS actually gave us of the types of organizations that are usually, right, subject to these conditions of participations: ambulatory surgery centers, community mental health centers, comprehensive outpatient rehabilitation facilities, critical access hospitals, end-stage renal disease facilities, home health agencies, home infusion therapy suppliers, hospices, public health agencies as providers of outpatient physical therapy and speech language pathology services. That's a mouthful. Here's a few more, kind of like tongue twister Tuesday. Psychiatric residential treatment facilities, programs for all-inclusive care for the elderly organizations, rural health clinics, federally qualified health centers, hospitals, right in the middle, we put that, right in the middle of these organizations that many of us have not heard of. If you are a hospital, you are covered by this rule, but I'm guessing most of our hospital clients already know that. Intermediate care facilities for individuals with intellectual disabilities, rehabilitation agencies, and long-term care facilities. Phew, okay, we got through them all. I put hospitals right in the middle just to give my mouth a break in the middle of that very difficult list. Here are some that the FAQ says specifically are not covered. Assisted living facilities, group homes, Medicare home care services, schools, independent physician offices. Note, those are not part of a hospital system, okay? So if you have a physician office that's part of a hospital system, they are going to be part of the rule, but if you are part of an independent physician office, like a dental office perhaps, that's not associated with one of these other organizations, you would not be covered by this rule. Home and community-based services, religious, non-medical healthcare institutions, organ procurement organizations, portable x-ray suppliers. Okay, so that is about as in the weeds as we're going to get on the coverage, because again, we believe that someone, if you on this call do not know if you're subject to Medicare conditions of participation, the quickest way to get, in the most accurate way, to get the answer to that question is to look within your own organization first. If by doing that you still can't find the answer, please reach out to your favorite Miller Johnson lawyer and we will help you work through that analysis, right? But it's probably going to be too fact specific to answer on a call, on a webinar. We did get many questions ahead of time with specifics, and I think we got to all of those just in these slides. We had a question about dentist office, about schools, et cetera. So I think we got to most of the questions that were asked ahead of time. Okay, so those are the types of employers, facilities, I should say facilities that are covered. Keep in mind that the rule is facility specific. It is possible to have one corporate entity that has some facilities that are covered and some that are not, okay? So it's facility by facility. Now let's talk about within a facility, which employees are covered by the rule, right? Which employees must be covered by your mandatory vaccine policy. The rule refers to the term staff, which Sarah and I discussed yesterday. It's very confusing, right? As employment lawyers, what does staff mean, right? I'm just gonna read you the way the rule reads and then we can discuss the ambiguity. The rule says facility staff are covered, and facility staff include employees, licensed practitioners, students, trainees, volunteers, individuals who provide care, treatment, or other services for the facility and or its patients under contract or by other arrangement. Okay, so that last clause is obviously extremely broad, could be read as being extremely broad. The rule is specific that it applies whether or not the staff has clinical responsibility or patient contact. That's a very common question. So whether your employees, your staff have patient contact or in a clinical setting is not relevant for determining whether the rule covers that staff person. It is unclear if the term staff modifies the other categories or not. So the way we wrote this first bullet is how it appears in the rule, right? It says facility staff is covered and facility staff includes the following. When Sarah and I hear the word staff, we think employee, right? We don't think, for instance, you have an electrical outage, right? And you call ABC Electric to come, within the hour and fix it, and then ABC Electric goes off. We don't think of those folks as staff when we talk to clients, and I'm sure you all don't either. But a very broad reading of the last clause of this rule could possibly include those folks because they are providing services for the facility under contract or by other arrangement. So the question that Sarah and I have is that staff who also do these other things, or is the term staff almost irrelevant to the analysis, right? And we just look at the specifics. We don't have an answer for you yet. We are looking for guidance. Frankly, the guidance that came out so far is pretty inadequate in a lot of areas. This is one of those areas we're hoping for additional FAQs or guidance from CMS. If this is causing an issue for you and your organization, and you have specific questions about folks who may be on your premises and you need an answer one way or the other, please reach out to us. And that's really has to be handled on a case-by-case basis. We're afraid. We know you all hate when lawyers say that, but that unfortunately, that's the situation we are in. Okay, which staff are not covered by the mandatory vaccine rule? Out, right? This is the last bullet. Who's out? People who work exclusively, okay? Exclusively outside of the facility setting and who have no direct contact with patients, residents, patient families, other caregivers, or other staff. So when I think of this, I think of the worker who is 100% remote, maybe even out of state, right? Working in their home, who never comes on site for anything, right? Those folks are not covered. Sarah, anything to add to that one? It's a pretty narrow.
We have a couple of questions though. Should we pause here and take a couple of questions?
Yes, let's do that. You want to handle those?
Sure.
Okay.
First question is this one, which I think is a great question. Given the timeline of compliance, right? The rule says everyone must have received their second shot by January 5th, right? What does that mean then for people we hire after January 5th, right? Who start working after that date? Does that mean they have the same timeline to get vaccinated if they're not? Or does that mean they have to come in the door with their 2 shots already completed by January 5th? And it appears it's the latter, unfortunately, right? So for new hires after January 5th, they have to have received their second shot before they start working in order to comply with this rule, right?
Yeah, I agree with that. Yep.
Okay. Second question I think is a great one. What if my business does not fall under this rule, right? We don't accept or we don't have a contract to a condition to receive Medicare or Medicaid under the conditions of payment or participation, et cetera. But we are an agency that provides staff to facilities that do, right? Is it our job to comply with this rule? And the quick answer is, well, no, it's not. You're not subject to this rule if your facility is not subject to the conditions of payment or participation, et cetera. Of course, there's a big but, right? And the big but is, but your customer, however, probably is, and you should be anticipating getting a phone call very soon from your customer who is going to tell you that they now need to make sure that the people you are providing to them to work in the facility are either can comply with the rule. So even though you're not subject to it, unfortunately, you are not going to escape some of the heavy compliance lifting probably, because you are going to be having to determine which of your staff are vaccinated, which are not, if they're not, whether they are eligible for an accommodation, et cetera. Okay. All right.
That for now?
That is good for now, yes.
Those were great questions. It's almost like they heard us talking yesterday.
I know, right?
You and I discussed those very same things. So,
Right.
So glad those questions came in because they were on our minds too. They're probably on lots of other folks' minds as well. Okay, let's talk about now the policy. Okay, so the rule requires all covered organizations to have a policy. We're all used to now the concept of COVID policies. This one is very specific about what the policies must include. And we're just going to go through it bullet point by bullet point. It will not shock you that we already have a policy developed for the OSHA standard. We're working on a policy, right, that will be compliant for this one. There's still lots of decision points to be made for sure within the required policy elements, but these are the things you need to consider. The policy needs to include all of the following, and there's several slides here. A policy for ensuring that all staff have received at minimum a single dose COVID-19 vaccine before the first dose of the primary vaccine series for multiple dose COVID-19 vaccine prior to the staff providing any care, treatment, or other services for the facility and or its patients. And as Sarah said, this does include new hires. So that needs to be part of your policy. You need a process for ensuring that all staff are fully vaccinated, period. You need a process for ensuring that implementation of additional precautions intended to mitigate the transmission and spread of COVID-19 for all staff who are not fully vaccinated. Now here you may be scratching your head and thinking there's a typo and thinking to yourself, well, Rebecca, you just said that everyone has to be fully vaccinated. So why do we need precautions for unvaccinated people? Or as you will see, you need to consider requests for exemptions, right? So that's why that bullet point is there. Some of you at the end of this process may still have employees who are unvaccinated or people coming onto your site who are unvaccinated, and you do need a process for ensuring there are additional precautions for them. You need a process for tracking and securely documenting the COVID-19 vaccination status of all staff covered by this rule. You need a process for tracking and securely documenting the COVID-19 vaccination status of any staff who have obtained any booster doses as recommended by the CDC. We'll get into more detail on how boosters fit into this in just a moment. Just know that you do have to track the booster status as well as the other vaccination status. You need a process by which staff may request an exemption from the COVID-19 vaccination requirements. And again, more on this, more details, plenty of details coming up on this in just a few minutes. So hang on if that made your blood pressure rise, we've got you. Your policy needs a process for tracking and securely documenting information provided by those staff who have requested and for whom the facility has granted an exemption from the staff COVID-19 vaccination requirement. So those two go hand in hand, right? You need an exemption process and you need to retain the documentation, right? That basically evidences your process as it applied to every employee who was granted an exemption. You need a process for ensuring the documentation supporting a medical exemption. And this rule goes into a little more detail than some of these other vaccination rules, right? About what you need, what kind of documentation you need to support a request for a medical exemption. None of this really changes any of the rules that we've lived with as long as I've been practicing employment law, but it is something that a lot of folks just may not have top of mind because they just don't deal with this really frequently. And my own interpretation is CMS put more detail in this rule because they're only dealing with healthcare providers, right? People who can literally write notes for themselves or have coworkers, colleagues, et cetera, right? So they put a little bit more detail into what type of documentation, not just that is good practice. Sarah and I have always said this, these sorts of things are good practice. You are actually required under the rule to collect this documentation. The documentation requesting a medical exemption must be signed by a licensed practitioner who is not the staff person requesting the exemption. Okay, you cannot request a medical exemption for yourself, even if you're a licensed practitioner. The licensed practitioner must be acting within their respective scope of practice, right? So a orthopedic surgeon probably cannot write an exemption request that deals with, vaccination allergy, for instance, right? The documentation must include all information specifying which of the COVID vaccines are clinically contraindicated and the recognized clinical reasons for the contraindication. Those are words directly from the rule, by the way. I don't use the word contraindicated very often. And notice, I try to use very small words. And
not
notice,
once in law school.
you notice I
think
slowed down
we
before.
Ever use the word contraindication? Yes.
Did you hear me slow down before saying?
I did.
That's why. Okay, and note the part that says recognized clinical reasons. So unlike religious exemptions, which we're going to get to, don't worry, I know that's on all of your minds. The medical exemption has to be based on a recognized clinical reason. It cannot be one licensed practitioner who's come up with a theory on his or her own, right? And is now writing an exemption request for a patient. You also need documentation, a statement by the practitioner recommending that the staff member be exempt from the vaccine requirement based on recognized clinical contraindications. Of course, we recommend that you have a form ready to go, right? Asking for all of these specifics so you're not winging it each time an employee would like an exemption based on a medical reason. You need a policy, back to what the policy must include. That's actually where we still are. The policy must include a process for ensuring the tracking and documentation of the vaccination status for any staff for whom vaccination must be temporarily delayed as recommended by the CDC. So the CDC does recommend that for some people, they can get the vaccine in general, but just not right now for certain reasons. And you need to document that. Note these are only reasons that are recommended by the CDC. We've already seen some delay requests for reasons that someone heard from their sister-in-law, et cetera. I heard I shouldn't get it because of XYZ, but it has to be included by the CDC as one of the reasons. And again, you need a contingency plan for staff who are not fully vaccinated for COVID-19. And most of you will have some. So that brings us to exemptions. And
hey, can I interject just 1 second? Because
yes,
I have a question that's based from several folks that's along the same line. So let me take care of that before we dive into exemptions. It goes along, it's something like this, Rebecca. When we say we have to have a process for ensuring that staff are vaccinated, what does that mean? Do we have to have their cards in hand? Is an attestation form sufficient? And in particular, what if I'm that contractor to a facility that's covered by this rule? Should I be sending my staff's vaccination cards to the covered entity? Okay. So the first thing I'll say is, with regard to those contracted staff, that rule about having a process to ensure they're vaccinated does include them. Remember, that term staff probably includes those contracted staff. Okay, so the covered facility is obligated to have a process in place for ensuring that those people are vaccinated. Now, the bad news is the rule and the FAQs do not have any sort of detail about what is sufficient to be a process for ensuring vaccination. Okay, so if you're a contractor, you are probably going to get different information from different facilities based on how they're interpreting that. Some facilities may tell you, we need copies of those cards because that's how we are interpreting our obligations and we're doing so conservatively. Other facilities may tell you as a contractor, just you guys confirm it and sign some sort of attestation form for us, stating that all of these folks are fully vaccinated, okay? If you are the covered facility, I think to have a process in place to ensure vaccination, quite frankly, you really probably should be confirming it directly through the vaccination card or other vaccination records stating that those staff are indeed vaccinated. Okay.
From a practical point of view, I've been to a few places recently, which I won't detail for you, it's beyond the scope of this webinar, that required proof of vaccination status to be there. And those places just had apps, right, where you cleared it ahead of time. And then as you walked through the door, the entrance gate, right, you showed your phone and there was a big green check mark. That type of technology exists. So for folks thinking, how do I make sure that everyone that steps on foot onto the facility, right, into the facility, you may want to look into something like that. And then if you have a greeter at the door, right, or something like that, that may help you logistically work through this. Yes, that will cost you extra money, and where you're going to hire someone to do that in this labor shortage, I can't answer that question for you, but just an idea. Okay, so
thank you, Rebecca.
Now, let's talk about exemptions, and let's also just recognize that a lot of our healthcare clients, particularly hospitals and others, frankly, have already started down the mandatory vaccine policy road, right? It says they're a few months into it now, and we have been with them the whole way. And what anyone that started this process already knows is that this is really all about the exemptions, right? That's kind of where the rubber hits the road, where most of your time will be spent. Once you implement a policy, you will get requests for exemptions. The rule does require you to consider exemptions under the ADA and Title VII, so that it would be for a medical reason or for a sincerely held religious belief. We know that's the law anyway, but the rule makes it explicit, right? That you have to consider exemptions under either of those laws. But this is interesting, and I put it in quote marks so that you would believe me. The rule says the following: no exemption should be provided to any staff for whom it is not legally required or who requests an exemption solely to evade vaccination. Now, if anyone has the answer of how we know who is requesting an exemption solely to evade vaccination, please come work for us at Miller Johnson, because this is the struggle right here. Every HR person at every one of these covered organizations wants to know, how do I know, right? If the exemption request is a legitimate one or solely to evade vaccination.
Rebecca, I think the answer is obvious, and that's when they say it on social media. That's how
Yes, those rare occasions where they say, I don't want the vaccine, I'm going to go lie to my employer in the morning, and tell them I'm pregnant. That actually happened. Boy, if only everyone would just open their soul, right? In that way on social.
Thank God they don't, right?
Media. Note that the other rules do not include the other vaccine rules, which we mentioned, there's quite a few out now, do not include this kind of language. So this is a message from CMS giving employers permission, I believe, to take a closer look maybe, right? And make sure that the exemption requests are legitimate. The rule also says the following: in granting such exemptions or accommodations, employers must ensure that they minimize the risk of transmission of COVID-19 to at-risk individuals, in keeping with their obligation to protect the health and safety of patients. And then the rule asks employers to look to the EEOC guidances for further information. We're going to give you further information now in the next few slides, but if you would like more, the EEOC has 2 documents that deal with accommodations. One is frankly completely aside from COVID-19, that guidance that's existed for a long time now, because these concepts are not new. Providing accommodations for sincerely held religious beliefs is the one I'm thinking of. That's not a new concept. It's just something that a lot of employers are dealing with for the first time. There's EEOC guidance you can find online that talks about employers' obligations to accommodate, to provide accommodations for sincerely held religious beliefs. Again, it's not COVID-19 specific. And then the EEOC has a COVID-19 specific guidance that talks about basically all sorts of ADA and Title VII issues, right, that are implicated by COVID-19. Very broad, started at the beginning of COVID-19, and I was just looking at it again yesterday, and some of it will kind of make you laugh, right? Because some of it came out right at the beginning, but they have added very recently, added some sections on mandatory vaccine policies and the types of accommodations to consider and the process you need to go through. Everything we're about to tell you is consistent with the EEOC guidance, but the EEOC guidance provides many, 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 many more pages on what we're about to tell you. Keep in mind, first of all, we're going to focus on sincerely held religious beliefs here in terms of what counts, because the rule provides specific information already on medical exemptions, right? We already talked about that a few minutes ago. Does not go into detail on the sincerely held religious belief exemption. So that's what we're going to talk about a little bit more here this morning. Keep in mind that the definition of a sincerely held religious belief is very broad, broader than you probably think if you've never had to think about this deeply before. And the EEOC advises that employers just assume the request is based on a sincerely held religious belief, practice, or observance. Now, this is from EEOC guidance that's unrelated to COVID-19, right? Generally speaking, it's awfully hard to show, practically speaking, it's awfully hard to show that a belief is not sincerely held. But not every sincerely held belief is religious in nature, right? Religious beliefs include theistic, in other words, a higher power, but also non-theistic beliefs. So it doesn't necessarily have to be connected to a higher power, though that's normally how these things are presented. And it has to be a belief system as to what is right and wrong, which is sincerely held with the strength of traditional religious views, right? Right and wrong, morals, ethics, big picture type of issues, okay? What are not religious beliefs? So not everything is a religious belief, even though it is very broad. Politics, right, are not religious beliefs, even though some people believe in them as strongly as religion. Concerns regarding the safety of the vaccines. We've certainly seen lots of exemption requests based on that, but that would not be a religious belief if it's if the exemption request is about, I don't think it's been tested enough. I don't think it's, concerns like that, right? It hasn't been in existence long enough for me to feel comfortable with the safety of it. That is not a religious belief. Just personal preferences, right? I don't like to get vaccines. I don't like to put foreign substances into my body. I eat only organic food that I grew right in my backyard, and that is it. Those sorts of things would not be religious beliefs, most likely. If an employer is aware of the objective, I'm sorry, I have to move my, sorry, someone put me in charge of the slides. I think that was me. I put myself in charge of the slides, and this is what you get. If the employer is aware of objective information that makes you question the religious nature or the sincerity of the belief, you can request additional information. Normally, this is a road to nowhere. I'm just going to be blunt with you. We've gotten lots of questions about this, and lots of clients have chosen to ask for additional information because they feel in some instances they're being yanked around. But I'm just telling you, likely it will still count as a legitimate request based on a sincerely held religious belief. But if you have an objective basis, and for healthcare institutions, the most common is we have required vaccines for years and years, not COVID-19 vaccine, obviously, but the flu vaccine and perhaps some others. And this employee has taken it without question. Why are they now saying they can't get a vaccine? I think that is a fair question. Plenty of healthcare employers are asking that question, but just know that employees will have answers to that, right? Which will then still qualify them for an exemption request, okay, a valid exemption request. Exemptions that create undue hardships are not required. So now let's get, the first step was, is there a valid request, right? Is this request based on a sincerely held religious belief? Next step, assuming the answer is yes, what do we do, right? Do we say, okay, you don't have to get the vaccine, you can continue on in your current job? Do we say, okay, but you have to do another job? Do we say, okay, but you're going to be on leave? Do we say, okay, but you'll have to do your job from home, right? What do we do with that request? Keep in mind that exemptions that create undue hardship are not required, and the undue hardship standard in this setting is much lower than it is under the ADA. Okay, most of you are much more familiar dealing with accommodations under the ADA than for sincerely held religious beliefs. Anything more than a minimal cost or burden, right, is going to be an undue hardship. And certainly in light of what the CMS actually said in its rule, anything that puts your patients at risk, right? Anything that puts your patients at risk would likely be an undue hardship. Because remember, they said you have to consider exemptions, but you don't grant them, right? If they're going to put your patients at risk, you can only grant exemption requests with keeping in mind your obligation, right, to keep patients safe. So what is the process for exemptions? Remember, the rule requires you not just consider exemptions, but actually have a process. This is what you need to do. You should think about a timeline, right? When do employees need to submit their exemption request to you to give you enough time to review it and make a decision for them, if it's denied, to still consider getting a vaccine? Okay, so you need to think that through. You need to have request forms ready to go. We suggest one for religious, sincerely held religious beliefs, and one for medical reasons, because the medical reasons, require, again, all of that additional information. You should have those ready to go. You should identify the individuals in your organization who will be making the decisions. Here's some good news for the HR folks on the webinar, Sarah. It's probably best for you not to do this alone, right? In a silo. If you are covered by the CMS rule, you are involved in healthcare in some way. And I personally, right, HR should be involved, but someone, right, on the healthcare side of things, on the operational side of things, needs to be involved as well, right? Because they're the ones that understand a little bit better than employment lawyers and HR folks, risks to patients and those sorts of
That's exactly right.
things. So a little bit burden off of your shoulders, but identify those folks and make sure, by the way, they're folks that can act quickly, right? That have the time to get together for a few hours, go through a stack of exemption requests. If the committee decides that it is a valid exemption request, then the next step is your organization needs to consider the accommodations for that employee. Can they stay in their current role but be unvaccinated, most likely with additional precautions, right? You need to consider accommodations that may place the employee in a different role. We see a lot of organizations getting to that first step. Can they do this job with the vaccination or not? Right, and maybe not moving on to the next step. All of these vaccine rules, the EEOC and its COVID-19 guidance, I mean, they're very, very clear that you have to consider additional accommodations as well. Again, assuming the person can't stay in their current role, because if they can, right, that's the answer. If they can't stay in their current role unvaccinated, are there other accommodations? Thinking about things like transferring to other open positions, obviously for which they're qualified for. No, you do not have to bump someone out of a filled position or create a position that does not exist, right? No undue hardship. But if there's open positions for which they're qualified and that they could not be vaccinated, right, and be in that position, you should consider that. Consider things like if they test and mask, right? Can they stay in the current position or move to another open position, but with testing and masking? Is this a position that can be done fully remotely? Remember, employees, staff that are absolutely exclusively remote are not subject to the mandatory vaccine rule. And then we put others because really your imagination is the only limit there, right? And it can be very fact specific based on your organization, but you need to think creatively. And that is ultimately the question you need to ask. Is there any way to keep this person employed?
Right.
Despite the fact they're not vaccinated. Time for questions, Sarah?
Yeah, I have two. The first one is, what if we have an employee that has gotten the flu vaccine in the past, but now requests a religious exemption for this particular vaccine, right? And let me just say, you wouldn't be the first organization to have an employee who's gotten vaccines, whether it be flu or otherwise in the past, but as it relates to this particular vaccine now is expressing a sincerely held religious belief. So the first thing I'll say is, having gotten vaccinated in the past certainly does not automatically disqualify somebody from an exemption now as it relates to the COVID-19 vaccine. It is certainly possible, and we've seen it in lots of iterations, for people to articulate why they have a sincerely held religious belief specific to the COVID-19 vaccine, or why they have this new sincerely held religious belief and can't take any vaccine starting with this one going forward, okay? So what I would say is that information, it would certainly be sufficient to have a follow-up conversation with that employee to be able to understand why they got vaccinated in the past, yet they are expressing a sincerely held religious belief now that is specific to the COVID-19 vaccine. Just one example of a request that might apply is a statement from an employee that because they believe that the COVID vaccine was developed using a line of fetal cells specifically, they can't receive it due to their sincerely held religious beliefs, right? That's just one example. But we are also seeing lots of people who have brand newly found sincerely held religious beliefs as well. And they are allowed to do that. They are allowed to say, well, this is my belief has changed, or it's a new belief, etc.
There's definitely been a religious fervor
yes,
taking over the country recently.
Really, yeah, that's exactly right. Will CMS be checking exemption documents to ensure they are legitimate? That question just came in. We do not have any level of detail from the CMS about exactly what they are going to be doing. From a practical standpoint, it's hard to imagine they're going to be poring over every covered facility's exemption documents and questioning why you made the decisions you did. But they probably will ask to see your process, right? And make sure you've got that process in place. I don't think they're going to be splitting hairs over the application of Title VII and arguing about court cases and whether a particular employee's religious belief really was sincerely held or not, quite frankly. I think they're going to be just looking for the process and general good faith on the part of the employer. One last question I'll answer right now with regard to testing as a potential accommodation for an employee who can't be vaccinated due to a sincerely held religious belief. The question is, would it need to be done daily or weekly to be an acceptable accommodation? Again, we are in a gray area here, to be honest, right? The CMS rules and the FAQs don't even get near the level of detail there. But what I would say is we do have other information from OSHA And as you guys know, OSHA is the federal agency that governs workplace safety. And they have taken the position that weekly testing plus masking, right, is one way to help keep workplaces safe with unvaccinated employees. So I would probably be looking to that information in order to frame my approach, right, and to put some sort of context to what's reasonable and what's not. So I would say there's certainly a colorable argument that if you are subject to the CMS rule and you have employees who are have a sincerely held religious belief, one option potentially could be testing plus masking, and I think weekly testing testing every 7 days would likely be sufficient in order to protect that workplace.
And it may depend too, Sarah, on the specific employee's job, right? It may depend on whether the person is in a patient care role versus a back office role with a door that closes, right? There may be, so this is really, again, clients, employers hate it when lawyers say this, but a lot of those decisions are going to be very fact specific. And it is going to take up a lot of your time.
Right. And I just got one other follow-up question, confused by the potential of transferring to a different position. Mm-hmm. If your entire facility is covered by this rule, then obviously transfer to a different position isn't going to be helpful to you, right? Because all of your staff is going to be covered. But there are organizations, to be clear, that have some facilities that are covered by this CMS rule, but others are not. And that's where the transfer option could be a potential accommodation.
I also think too, it could depend on direct patient care versus not, right? You may be willing to have an employee who is unvaccinated in a back office accounting role, again, usually in an office with a door that closes, but say no to a direct patient care role. And for nurses, for instance, bedside nurses, you may say, no, we are not willing to accommodate you being unvaccinated, right? Treating cancer patients or hospice patients or at-risk patients. But there are plenty of office roles that nurses also do in those types of organizations, right? So those are the types of things to.
But again, and that would only be in the context of an employee who is eligible for an accommodation due to either a medical impairment or a sincerely held religious belief.
Yep, absolutely. That's
all right.
Great questions. All right, one more thing I want to cover, and then I'm going to give us a plug for tomorrow's podcast, and then we'll let everyone get back to work. Let's talk about boosters for a moment, because healthcare organizations are in a unique situation compared to lots of our other clients, because there's been this recommendation out there for a while, right, that healthcare employees get boosters. So the rule says that staff are considered fully vaccinated for COVID-19 if it has been 2 weeks or more since they have completed the primary vaccination series. Okay, so that's a standard we're all familiar with, right? 2 weeks after either your second shot of Pfizer, Moderna, first shot of Johnson & Johnson. That standard for what counts as the definition of fully vaccinated has not changed. Okay, this rule does not change that. Completion of a primary vaccination series of COVID-19, right, is the single dose of J&J or the double dose of the other. Fully vaccinated does not include getting the booster, but I will say this for now, right? Does not include boosters for now. Stay tuned, because the rule, as you heard me say earlier, does require you to track which of your employees received the booster. And that just left us scratching our heads saying, well, why? Would the government require you to track the boosters if at some point it was not going to be relevant to the government, right? Who had a booster and who did not. So we will say, as of Tuesday morning, November 9th at 8:55, boosters are not required to be considered fully vaccinated and compliant with the rule, but stay tuned. Okay, last thing. Sarah and I, not in light of this rule, just about a week or two ago, recorded a podcast specifically on the exemption process and mostly on sincerely held religious beliefs. It is coming out tomorrow. It just happened, it was scheduled to come out tomorrow anyway, so the timing, it was great. So if you want, frankly, a more casual conversation about it and a longer conversation about it, look for that email with the link to our podcast on how to work through religious accommodation requests for exemptions to the COVID-19 vaccine.
Yeah,
Okay,
Sarah, and that will be a webinar tomorrow morning, Rebecca, but also after that will be available on the podcast app. So anybody can search Off the Clock, Miller Johnson, find our podcast and find that particular episode, plus lots of other great episodes too. So one last question and a great note to end on. The question is, will Miller Johnson have some language available to its clients for these new policies and procedures? And the answer is, of course we will. As we are presenting today, we've got lots of people working on writing the policy and writing that specific medical form, et cetera, that complies with the specific requirements of this CMS rule. So absolutely, yes. So,
yes, what a great question.
Yeah, exactly.
So one of our fans.
Thank you everyone for joining today. And thank you, Rebecca, for your awesome presentation. We are grateful.
Thanks everyone. Have a great day.
Have a great day. Bye-bye.